we continue with a conversation tonight on the perceptions that South Africans have on the vaccine. University of Johannesburg has released a survey that probes the reasons South Africans provide for their willingness or hesitancy to receive the COVID-19 vaccine. The survey reveals socio-demographic variables that potentially shape the willingness to vaccinate. To unpack this further, I'm joined now by University of Johannesburg Chair of the Center for Social Change, Professor Kate Alexander. Prof, good evening, and thank you very much for joining us tonight here on In Focus. As far as your study is concerned, what does it reveal in as far as the work that the South African government has put in place to educate people about the benefits, the pros and cons of vaccinating? Have we done enough as far as health education is concerned?
Well, I think the message is very mixed. The main finding, the headline finding, is that the proportion of South Africans who want to take the vaccine has increased since we did a similar survey back in February, from 67% to 72%. So that's very good news. It shows that most of us want to take vaccines. But then there's a gap between that and the number of people who have actually taken vaccines, about 20% so far. Of course, there'll be more now because of people from 18 to 34 being able to vaccinate from the 1st of September. But there is that gap, and the question is, how do we fill that gap? And what we're finding is that the key issue is really about access. That's the main thing. Of course, there's still an issue about how do we communicate properly, and that is important because there are issues that concern people about side effects, for instance, other issues. And I think on those ones, we have to be very patient in the way we explain the problems, the responses, and so forth. And I don't think we should panic too much about it. The key thing is, how do we get those arguments across? And some of that is to do with television. Television is the most important source of information for people in South Africa across all demographics.
I'm going to come to that, to the most trusted media that people are receiving their information from. But let's then talk about the vaccine hesitancy. I mean, explain that, particularly in males. The Premier of Gauteng says men in particular in this province are quite hesitant to take the vaccine.
Well, it's not only in South Africa, but we have to avoid overstating this problem. If we look at the figures for acceptance, in other words, the people who want to take the vaccine, it's actually higher amongst men than it is amongst women. The problem is more to do with who is actually taking the vaccines. And then we find that there's rather more women than men. Now, one of the reasons for that is that so far, the largest cohort of people who have been vaccinated are the over 60s. And amongst the over 60s, the overwhelming majority are actually women. About 60% of the over 60s are women, 40% are men. So there is some difference between men and women, and there are some differences in terms of their reasons for hesitancy. Amongst women, for instance, the key issue is side effects, whereas amongst men it's more to do with whether or not they are trusting of the government and of the vaccines and so forth. So there are slightly different issues there.
Yeah. How much of the conspiracy theories are actually contributing to this hesitancy?
Well, that's very interesting. There's a lot of fuss made about conspiracy theories, but actually they don't come up at all strongly in terms of the reasons that people actually give for why they won't take the vaccines. That's not the key issue at all. And interesting, nor is social media. I mean, the two things often are connected in people's minds. And social media is not the main source of information for most people. So we can exaggerate some of these things.
Yeah. I tell you, the group of people that I have spoken to would speak about the effectiveness of the vaccines, one of the more dominant concerns. For example, there's this misunderstanding that when you take the vaccine, it means you will not get infected. And then so people then get a little bit worried when they hear someone who was vaccinated a month ago now saying, I've caught the virus. I mean, is that being cleared up?
Well, I think that's a very important issue that you raise, and to some extent that's our own fault for not explaining this early enough, that vaccination, even with 2 doses of Pfizer, does not give you full protection. Of course, the chances of you getting seriously infected are minimal and not really worth worrying about, but there is the chance of people still getting mild to moderate infections. even after 2 doses of the vaccine. So it is something we have to be concerned about. The thing that worries me much more than that is people not taking the vaccine, and this is true particularly with younger people, not taking the vaccine because they think they don't have to, because they think that they are safe without taking the vaccine. And then, of course, they could become infected because they haven't been vaccinated. It may be a mild infection. They might not even know they've got the infection. And then they pass it on to other people who might experience far more serious symptoms. So these are one of the problems that we face, particularly amongst young people, where the level of acceptance is really very low. We've got to begin to win the argument for getting vaccinated.
Yeah. What is the level of those who are adopting a wait-and-see attitude? They're not necessarily anti, they're not necessarily pro, but they're saying, let's wait a little bit until more people get vaccinated and see what actually happens, and maybe we might take them.
Yes, that situation does exist. You've come across it, I've come across it. And I think what usually happens is that most people then see their friends are being vaccinated, there are no serious side effects, and so they do get vaccinated. So with some of these issues, we have to be patient. I had a friend, for instance, who said that her mates, her neighbours, were very worried about magnets in the vaccine. So she just took them along with her to watch her being vaccinated, and then she said, feel it, feel it. And they couldn't find any magnets. So, of course, they then went off and got vaccinated themselves. So I think the experience of what one's friends and neighbours and family are finding is actually very important in terms of determining whether or not people are vaccinated.
Yeah. One of the most prominent concerns that I've been hearing from health professionals themselves is this question of 35 and younger are on social media platforms, they are on computers, they've got access to information, and some of them are now ready. They've got the right information, they know that vaccines are effective, and they are ready to take them. But these barriers that we have put in place to limit age groups and so on and so forth are actually what is hampering the progress in as far as vaccinating more people. What is the study revealing? Is it indeed true that 35 and younger, there is a huge group of them that will take up the opportunity as soon as it opens up?
Yeah, the majority of people under the age of 35 do want to get themselves vaccinated. There's a bigger problem with people who are under the age of 25. That's what we're finding. So it's particularly the younger part of that cohort where there's a level of substantial hesitancy. And we don't know for sure the reasons for this. It does match international experience. And internationally, when we look at the explanations that are given, some of that is indeed to do with what people term as lingering effects. In other words, we've said at an earlier stage that the vaccine should go to older people because they're most vulnerable. And the implication, of course, is that younger people aren't vulnerable. And some people take that literally, and they think that they're not vulnerable at all, so they're not that keen on taking the vaccine. But the majority still of younger people, even in that youngest group of 18 to 24, they still want to take the vaccine. And the problem we face is, can we make sure we get it to them? And that's a problem through all of the age cohorts. That's the biggest issue that we face. Can we get vaccines to the people? That's the way the acting minister put it. And for us, doing this research, that's our conclusion. That's the main problem. How do we get vaccines to the people? And that's going to matter a lot to the universities in particular. The universities, by and large, have students who are under the age of 24. How do the universities make sure that they can get vaccines to their students? Can they organise vaccine sites on the campuses? Now, although many of the students are now working online, there are also some students on campuses and students living around the campuses. So getting vaccine sites close to the students on the campuses is very important.
Now, you've raised, of course, some clarity on the areas of concern. Does the research give any recommendations or at least advice on how do we expand the level of vaccine penetration?
Well, yes, the key thing is access, and it comes up in a number of different ways. For instance, there are racial differences. So the level of acceptance amongst white people is considerably lower than it is amongst black people. But the level of vaccination amongst white people is considerably higher than it is amongst black African people. And we can see that the key reason for this is that white people have more access to vaccines. A higher proportion of them have cars. And we know that people who've got cars are much more likely to get the vaccine than people without cars. People with medical aid are more likely to get vaccines than people without medical aid. So the key issue is access. Now, some provinces are getting this right, notably Limpopo. They have a model of a hub and spokes. So the hub is a fairly large hospital, and then the spokes extend outwards to small sites in rural areas, extends outwards to mobile units in even smaller areas, and they advertise them properly. It's going to be in your area on the Monday, your area on the Tuesday, and so forth. And they even managed to get vaccination units, 1 or 2 vaccinators, out to people where they are disabled. So some provinces are getting this right and others aren't. And what we have to make sure is that all of the provinces are making sure that they get down to people, in particular in informal settlements, and the problem is especially an urban one, it's especially in informal settlements, the level of acceptance and the level of vaccination is rather higher in rural areas than it is in urban areas.
University of Johannesburg Chair of the Center for Social Change, Professor Kate Alexander, appreciate your time and thank you very much for joining us tonight.